Hi again. I'm Johnathon Crumley, Chief Operations Officer and one of the person-centered thinking trainers here at IntellectAbility. In this video, I'm going to walk you through what to expect during an HRST screening, so you can feel prepared and confident going into the meeting. These screenings are conducted virtually using video and audio through Microsoft Teams. At your scheduled appointment time, simply join the meeting using the link provided in the email you received after scheduling. If you are early, you may be placed in a virtual waiting room until the meeting host begins the meeting. Once the meeting begins, everyone will introduce themselves. In keeping with a person-centered mindset, the person to be screened is encouraged to be a part of the meeting, if they choose. After introductions, the HRST rater will explain what to expect during the screening. They'll let the group know that some questions may feel a little personal, but they serve an important purpose. Before getting started, the rater will ask who the respondents will be. That's the people who will help answer the screening questions. If the person being screened isn't able to answer directly for any reason, the respondents can answer questions on their behalf. It is very important that respondents be supporters who know the person very well and have access to their health information. Next, the rater and respondents will review the person's diagnoses. The focus here is on understanding the person's health conditions and how they may impact rating item scores. Then, the rater will move on to the person's list of medications. They'll ask questions related to the person's medications to inform scoring and to better understand their health picture. Once diagnoses and medications have been reviewed, it's time to begin the screening questions. These questions should be answered yes or no based on the person's experiences over the past 12 months, unless otherwise told by the rater. The rater will briefly go over the 5 major categories covered by the HRST, each of which includes specific rating items that help break the categories down into more detailed areas of focus. Once each rating item is scored in a given category, that category will be assigned a score. Once all 5 categories are scored, the overall healthcare level is then calculated. Remember, the higher the healthcare level, the higher the overall detected risk. At this point, the team will be able to note where risks have been identified and the severity simply by looking at each rating item score. The rater will look at the rating item scores and discuss select person-specific service and training considerations. These are the actionable suggestions that can be put into practice immediately to help reduce risk and support better health outcomes. The rater will answer any remaining questions you have, and then you can take what you've learned and start implementing the considerations right away. If you have any questions about the service and training considerations or other questions related to the HRST, the rater can connect you with your assigned HRST service and clinical representatives. Thanks for taking the time to learn more about the HRST screening process. We hope this gives you a clear understanding of what to expect and, more importantly, how this process can lead to meaningful supports and a better quality of life for the person.